It is really a pleasure for me to introduce my great friend Attilio, who has a very difficult presentation today because he's speaking about bioimpedance assessment of compression in lymphedema, but I'm sure that he will make very clear his presentation and we will be very happy to understand more on bioimpedance. Attilio, please.
Thank you very much. Can you see my desktop?
Yes.
Yes,
okay.
We can see it.
Okay. So I slightly changed the title, just talking about lower limb edema and not just lymphedema, let's say. So this is my disclosure slide, but these companies had no interference on my, let's say, on my presentation. So long time ago, 22 years ago, we started to think about edema as an issue of fluid, but also, so we mean venous and lymphatic problems, but also it was an issue since the very beginning of tissue, interstices. So bioimpedance was started long time ago for many other reasons, but about in 95 and then in 2001, the Australian colleagues started to speak about the use of bioimpedance, especially in lymphology, in lymphedema, and the very first articles clearly highlighted the possibility of this new technology. With Dr. Shingale and Dr. Elio, I had the luck to publish this article trying to evaluate a few devices to investigate limb volume measurement, and somehow we spoke about bioimpedance, though we know that other methods are considered somehow the most validated ones, such as water volumetry, for example, or simple volumetry derived from circumference measurement. We have an issue. The issue with this method is that when we measure volume, we may measure, for example, fat changes, we may measure muscle changes, and not just fluid changes. That's why we probably need, let's say, a more validated and more sensitive method to assess the changes of fluids, especially fluids, and not just the volume of the limb. And this could be the option for bioimpedance. Furthermore, when we speak about tissue assessment, things are more complicated because we know that we have ultrasound, tonometer, biopsy, but again, a more sensitive method could be possible. And here, bioimpedance comes. What is bioimpedance? Well, everybody knows about bioimpedance in the body, let's say, for, let's say, nephropathic patients, for example, or for nutrition reasons. But with the low intensity alternating electrical current, we may investigate the tissues because they are a kind of conductors and semiconductors which, when they are pass through the electricity, they respond, and we can investigate at the end of the day the extracellular fluids, the intracellular fluids. And the basic principle of bioimpedance is that the impedance is inversely proportional to the amount of the extracellular fluid, including lymph. So the higher the impedance, the higher the consistence of the tissue. The lower the impedance, the higher the fluid amount. Beyond the classical extra and intracellular water content and the classical lean and fat mass evaluation, we know that bioimpedance, or better with bioimpedance spectroscopy, we can investigate the extracellular resistance, which is one of the two components of impedance. And the resistance relates to the extracellular fluids, so with edema. Reactance, on the contrary, deals with the, let's say, membranes of the cells, but even more recently, we know that cellular membrane capacitance is the parameter that we may get by bioimpedance to assess the cellular membranes. This is one of the possible devices you can use, this one from the U400 LDEX we use from the Australian company. It has been validated through a series of very good level articles. And the very beginning of this technology focused on the possibility to, let's say, investigate the lymphedema index, the LDEX, which means that you can divide one impedance of the affected limb, for example, over the unaffected limb. So through this index, you may understand if there is any difference between the two limbs in terms of impedance. When we started to apply this technology, we found some little problems because when you have a bilateral edema, this index is not applicable. And that's the same when you have fibrosis, for example. So at the end of the day, we decided to go through the raw data analysis. And the raw data analysis, when you perform a bioimpedance examination, permits you to know a little bit more about resistance. So we told before that the higher the fluid content, the lower the resistance, and vice versa, and also reactance, which means that the higher the reactance, the healthier the tissue. So through raw data, you can understand also cell membrane capacitance, which is the third interesting parameter you can get through bioimpedance. And it has been used, for example, in cancer and in other chronic degenerative disease. So these parameters can be very easily investigated through these devices, and then you can understand how much is the resistance in the limb or in the, let's say, segment of the limb, and then you can detect the cell membrane capacitance, which relates to the tissue. So you can investigate the tissue, and then you can also, of course, detect reactance, which is another way to detect the tissue composition. What we did in the last 6-7 years was to investigate a segment of the lower limb, for example, the lower leg, because we know that there may be differences when we have lymphedema or whatever edema between the distal part of the limb and the thigh. So to assess any kind of changes in the lower leg, in the thigh, and in the total limb, we were able to place the electrodes in a different manner, and so we were able to investigate. Now let's go to the literature about compression and bioimpedance. This is an interesting article which was focusing on, let's say, a pig spleen, so it was made on the animal, and they were able to demonstrate that when you exert very high compression, which means 80% than the basal 0%, you can get worse outcomes in terms of resistance and reactance. So again, it's a matter of dose. Too high compression can give you worse outcomes in terms of resistance and reactance, which was not the case with the classical compression, let's say 30 or 40% of the basal value. These are some data from this study. With 80% compression, the intracellular resistance increased, but the interstitial resistance decreased. So you did not remove the fluid from the interstices, but you removed the fluids from the inner cell. So this is interesting because that means that when we compress too strong, we have somehow a removal of the fluids from the inner part of the cell, not from the interstices. This is another article from the group of Gianesini, where they demonstrated with bioimpedance, that's another kind of bioimpedance device. So they investigated, in fact, the extracellular water, and they showed that the improvement of the extracellular water with the graduated compression stockings happen only when walking with stockings and not in a static, let's say, position. This is another study where they investigated bioimpedance analysis parameters with ulna boot versus, let's say, conventional dressings. And using ulna boot, they were able to demonstrate that after 1 day time, the bioimpedance values improved, which was not the case with classical, let's say, conventional dressings. So now let's move to our own experience. Somehow we were able to demonstrate that when performing, let's say, catheter foam sclerotherapy plus phlebectomy for varicose veins, compression 3 millimeter or 35 millimeter of mercury stockings gave different results. This is a kind of summarizing slide. You can see here again the main parameters of bioimpedance. So to make it short, using higher compression, such as the 35 millimeters, Struva 35 millimeter, you had an improvement of reactance and limb LDEX, both at 7 days and at 40 days. But what was interesting was that all the parameters, let's say resistance, that is fluid, reactance, that is tissue, significantly improved at 7 days after the operation, and they decreased at 40 days in both groups. So that means that without stockings, you can somehow deteriorate the improvements that you get with Struva 23 or Struva 35. Then we investigated the complex decongestive treatment of lymphedema, which included, of course, in this case, bandaging, and manual lymphatic drainage and so on. We investigated with volumetry and with bioimpedance. After 6 days course of the complex decongestive treatment, we had the volumetry reduction both in the total limb and in the lower leg, which was statistically significant, as you can see here. So now we are talking about volumetry. Then we investigated the bioimpedance parameter, and the resistance increased after the treatment, which means that the fluid decreased, both in the total limb after 6 days and in the lower leg, as you can see from this slide. That was the case also for reactance, which improved because it increased after the 6 days of the congestion treatment, both in the total limb and in the lower leg. And that was the case, of course, also for LDEX. To go to the very interesting point, what we found, thanks to the help of Luca Bastiani, our statistician, we found a very good correlation between the variations of resistance, reactance, and the LDEX, and the variation of volumetry. So somehow we were able to demonstrate that when employing this technology, you can correlate the volumetry changes with the tissue and the fluid changes in the limb. Now we want to present a very little data about a couple of incoming studies. You probably remember this study that with Dr. Mosti and Professor Parch I had the luck to perform. We published 5 years ago this study about the adjustable Velcro compression devices in chronic edema, which was better than inelastic bandages in reducing the venous edema in the initial treatment phase, which means at 1 day time and 7 day time. What we did, thanks to the improvement of the technical softwares and the revisions of all the data we had about that study, we revised all the data that we had, and the very similar improvement were found when using CIRC versus multi-layer bandage at 24 hours and at 7 days. You can see here, for example, bandage is in red and in green is CIRC. So if we look at resistance, reactance, and cell membrane capacitance, again, CIRC was better, both at 24 hours and, as you can see here, at 7 days. So it is another demonstration how bioimpedance can very clearly, let's say, evaluate, assess the changes in fluid and in tissues. Going to the end, this is a very simple and very, let's say, a preliminary study that I want to present you. We investigated just 5 working subjects with occupational leg edema, and we wanted to see what happens with stockings, class 1 stockings, panty stockings for 9 hours, from 9 in the morning till 6 in the afternoon. And we investigated just bioimpedance parameter. And very briefly, again, you can see that a little improvement if you investigate these patients the first day without stockings, the second day with class 1 stockings, you have an improvement of resistance in the total limb, an improvement on reactance, and an improvement of cell membrane capacitance. That was the case for the right and for the left leg. So using the stockings gives you improved values of bioimpedance. And again, that was true also for the total limb. What is somehow interesting, I go to the very end, is that also resistance of the total body improved a little bit when you have stockings on your limb. What does it mean? It just means that you increase your diuresis because the fluids somehow exit more thanks to the stocking. Probably this is our explanation. So this is my very last slide. The bioimpedance spectroscopy is a safe and reliable technology in limb edema assessment, and our data show a very good correlation between volumetry and bioimpedance parameters. And as we are starting to show, monitoring of compression therapy by bioimpedance spectroscopy can be of very important scientific interest because we can quantify the changes of fluid and tissues thanks to this, let's say, technology. Thank you very much.